happy to be here. So, first of all, I would like to convey the warm greetings of Iman Murphy, the UNAIDS Regional Director for Asia Pacific and Eastern Europe and Central Asia. Iman wanted to be here with you today, but he had some changes in his schedule. He requested me to join here, and I'm really privileged to be here with you today. And I also appreciate the responsibility of the task entrusted to me. So we have been requested to talk about the UNAIDS targets and where Asia Pacific region sits. So the first slide, I hope the colors are not too visible. Sometimes it's not quite clear, but really just to give you an overview of the global AIDS strategy. I'm not going to go into details for sake of time, but this is available also on UNAIDS website, and you will get the presentation. What is important to say about the global AIDS strategies is that it applies, it uses the inequality lens, the inequality framework, and really puts people at the center of the response. This is key to understand what will come next. I'm not going to go into details, but what is important also is to see that there are strategic priority areas, but more importantly, there are results areas. You have HIV prevention, testing, treatment. You also have all the issues around enabling environments, including human rights and community-led responses. And an important point also that the co-chair mentioned around the sustainability of the financing and the sustainability of the response. So when the global strategy was developed, a number of key targets were set up. These are quite ambitious targets, but you can see them there. Again, not going into details, but on the left side, you can see the 3-10-10, and you have on the right side the 3-95-95-95. So when we go now if we do a focus on the Asia and the Pacific region, it's important to say, you can see there the global and the regional summary of the AIDS epidemic, and you see that actually Asia and the Pacific, you need to understand that it's the second contributing epidemic to the global epidemic after sub-Saharan Africa. So the contribution, if I may say so, of the epidemic is not small. So there's still some work to do around the response. Here you have the declining new infections globally and regionally, and you can see that the AP region is lagging behind the global trend. And 21% decline during the last 10 years, but it's not enough. It has been, this decline actually has been stagnated, and you see that we are quite far from the 2030 target, which is 30,000 new infections per year. So there's still things to do about declining the new HIV infections. So on this slide, you can see how the key populations are heavily affected. And there are three things, main things here to understand or that to take away. First is that the key population and their sexual partners are profoundly affected by HIV in Asia and the Pacific. You can see that 96% of new HIV infections occur among key population and their sexual partners, and 46% are among MSM. Since 2010, you can see also that estimated new HIV infections among MSM has increased 5 times in Philippines, 11 times in Pakistan, doubled in Cambodia. And one point to mention is that the overlapping risks and transmission dynamics between and among key populations are clearly contributing to expansion of HIV epidemics in the region. Here you see also the diversity in the progress of the response, both in terms of HIV prevention and treatment. The upper graphic, you can see that the lower graphic also, you can see that some countries are doing well in HIV prevention and treatment, while some others are not. And if you see on the right side, so you have a number of countries which are doing well and others doing not so well. So you see for the HIV prevention, all the bars in red, those countries have still work to do. And for the HIV treatment on the right side, the countries in orange, and you can see the percentage of increase for Philippines, for instance, for new HIV prevention, and for deaths also for Pakistan regarding the HIV treatment. This slide is quite important. We already touched upon the left side about the distribution of the new HIV infection by population. So what I would like to draw your attention to is really the right side of the slide, because you can see that there are remaining legal barriers in a number of countries, and out of the 39 countries in the AP region, you still have 38 countries which criminalize some aspect of sex work. You also have, out of the 39 countries of the AP region, 17 criminalizing same-sex relations. So just to say that this is important, and this we need to touch upon those issues to advance the response. So if you see also there on this slide, on the right side, you can see that key populations and people living with HIV are facing stigma and discrimination in all settings, no matter if it's the health setting, the community setting, home, or the house setting. And despite the numbers that you can see, the example, for instance, of Iran, where you have 59% of key population facing stigma and discrimination, you still see that on the left side of the slide, less than 5% of people living with HIV are reporting seeking redress for violations of their rights in Vietnam. So there's still this tendency not to go and seek for legal services. And we really need to remove these barriers, because it prevents the people living with HIV and the key population to access to services, and we need to provide those equal rights to access services. This slide is really important because it focuses on young people and young key population from 15 to 24 years in the region. And if you see the left lower bar, the blue bar, you can see that how they are affected by the HIV epidemic, and you see that a quarter of new HIV infection are occurring among young people. This is the average of the AP region. But when you look at the bars for the countries, you can see that in countries like Philippines, Indonesia, Thailand, and Myanmar, young people account for 50% of total new HIV infection. So this is quite important. On the lower right graph, you can see also that almost all of the new infection, this is the 99% of new HIV infection among young people are occurring among young key populations. And new infections are rising among young people in countries such as Philippines, Afghanistan, Fiji, and Papua New Guinea. However, when you look at the comprehensive HIV prevention coverage, you see that it's very low among young key populations, and no matter if it's around, among MSM, you have 25% low coverage, which is very low, and also for people, young people who inject drugs. So things to do also there. Issue of services. Services remain largely inaccessible for most vulnerable population. If you see the prevention intervention coverage among key population in the region, you can see that MSM have a very low coverage, and we can mention at least two elements that explain the situation. This is on the left side of the slide, if it comes back. The first element is the criminalization, harmful gender norms, inequalities, stigma and discrimination, which really restrict access to HIV and sexual and reproductive health and harm reduction services. Also, inadequate policies and service delivery models do not respond to the needs of the populations that are the most affected by HIV. Here it's about the scaling up innovative intervention and differentiated service delivery. About innovative intervention, you have the example of PrEP here, where you have a number of countries which are doing well, like Australia, Vietnam, Thailand, and Cambodia. Of course, there's still way to go, because you see that we have a 14 million 2025 PrEP target. Up to now, we have only reached 120,000 estimated PrEP users in 2022, which is only 3% of the 4 million targets for 2025. So we still have to reach 97% of the target. In terms of prevention and treatment targets, we really need to reach the key populations who are underserved. And you can see here that in terms of HIV testing coverage among key population in the region, it's low, around 50% maximum, to make it short. And you can see on the left side of the slide that out of 39 countries in the region, only 26 have community-based HIV testing. Only 11 of them allow lay provider HIV testing. These are, I can go on and go on, but you can see how the situation is in terms of services that we really need to improve this situation. Here you have the cascade for the treatment cascade for where you can see the gap for the 395. You can see for the first 95, you see that we have a gap of 1.1 million to reach. For the second 95, the HIV treatment target, we have 1.4 million gap people to put on the treatment. And for the third 95, we have a gap of 1.6 million. So still improvement, and a lot of AIDS is not over. We have to scale up and we have to accelerate. And if we disaggregate the data, this is on the right side of the slide, you can see that adult male have 60, for the three targets, 76, 65, and 60 against the 95, 90, and 86 target for the region. Another interesting slide about the treatment gap, and it's important, as you know, to prevent death. And you can see that in terms of ART coverage and treatment gap, again, there is an equal progress in treatment coverage, depending on the country. And you see Thailand, Cambodia doing quite well, and Afghanistan, Pakistan, Indonesia, where the coverage, the treatment gap is quite important, and you have less than 30% of treatment coverage. And because of this diversity, it brings the region to, so you see the average of the region, 66, and then which is lagging behind the global trend of 70. Thank you. Another interesting information, it's around integration of TB and HIV services. Those integrated efforts, we talk often about that every time and we know that they are needed to close the health service gaps. But you can see that tuberculosis patients living with HIV on antiretroviral therapy, it's still low, and you have tuberculosis, you are still an important percentage of tuberculosis patients living with HIV who are not on ARV. So there is something also to do there. Those are two co-infections that we need to tackle in an integrated manner. Important also to mention the issue of mother-to-child transmission. And you can see here the service cascade of prevention of mother-to-child transmission of HIV in Asia and the Pacific. And you see that we still have 25% of transmission. In the first cascade and the second one, we still have to improve that. And with this 25%, this 25% makes the Asia-Pacific region the world's second highest rate of HIV vertical transmission. I mentioned, and also the co-chair introducing the topic mentioned the issue of resources and sustaining the efficiency of the HIV responses. What is interesting to see on the slide is that domestic financing has been increasing, which is a good news, but it needs to increase again, more and more. However, when you look at the target for 2025, which is 9.2 billion, and when you look at the available resources, you still you see that there is still a gap of 5.3 million. So we still have to push that, the political will, and making sure that the domestic financing is increasing to reduce the dependency on external funding. So just to mention also, you remember I mentioned to you community-led monitoring at the beginning of the presentation. You have the target 30, 60, 80, They are also detailed, but what is important is to understand that out of the 39 countries, you still have only 12 countries where NGOs can, you have registrations of people living with HIV-led organizations. And if they are not registered or they are not access to funding, they cannot operate and deliver programs. And 2 points maybe to emphasize really, it's the need to enhance the people-centered system for health so that the community systems are part of the health systems are also strengthened, and we really need to support community-led responses. So this is my last slide. I hope I can get an award because I'm left with 2 minutes and 11, but let me go quick. Okay. So the last slide maybe just to remind the targets, the 10-10-10, the 95-95-95, the 30-60-80 for the community-led responses. Remind again that the strategy is put people at the center of the response, and there are a number of things that we need to do. We need, first of all, to renew the focus on the key population. So, yes. So just to remind the targets again, which are important. People living with HIV and community at risk are put at the center of the strategy. 4 key messages to take away. We need to renew and intensify the focus on key populations in policies and programs. We need to modernize HIV service delivery. It's also key to eliminate the barriers to equitable program coverage among the most marginalized communities. And 4th, mobilize sustainable domestic financing for HIV response. And the last point, to do that, we really need to have people-centered and community-led public health response. We need innovations, hence scaling up PrEP and virtual intervention. And we need also human rights and human rights-based approach so that people can access to services. Thank you.